here?
Here we have local direct hyperthermia. What is hyperthermia? High heat. We know, science knows, that cancer cells are heat sensitive. Normal human cells are heat resistant. That's why when we have a flu, a virus, an infection, we get a fever to kill the bugs, but it doesn't kill our healthy cells, right? So now even in the US, they're using hyperthermia with radiation, and they're saying, wow, the results are better. Well, of course, because most of the damage selectively to the cancer cells are being done by the local hyperthermia.
And so that's what this is. It's a local hyperthermia machine.
Yes, and it's a very easy, non-invasive therapy. This is the one. Of course, if let's say the patient has a tumor in the breast, right? We put a conductive gel, natural, non-toxic. We crank up the device, and then the treatment is done externally.
Okay.
And this is using both capacitance and resistance, different types of energy to get to superficial as well as to deep tumors. This is another favorite tie. I know I told you several of them are favorites, but this is not only a feel-good therapy, but a very effective therapy. With the combination of sonophotodynamic therapy and local hyperthermia, we're getting at least a 52% decrease in blood supply to the cancer tumors or masses during the stay of the patient here. We know that angiogenesis, right, is one of the characteristics, hallmarks of cancer. So if we could decrease the blood flow to the tumor, we're well on our way to having an effective therapy.
Yeah.
And you know, maybe you saw some patients today who had an 80 or 90% blood flow.
We did, as a matter of fact. Now, as opposed to what we've already seen with the near-infrared sauna, that's also hyperthermia, isn't it?
Correct.
This is just a different machine that does the same thing?
Not exactly. It doesn't do the same thing because that's more for pulling out toxins. That's more for superficial opening up of the pores, for cleansing, detoxing. Okay. This local hyperthermia, and we also have full body hyperthermia here, is a therapeutic treatment for cancer.
Okay.
Meaning it's going after the cancer cells, it's going after the bugs.
Got it.
The viruses, the bacteria, the fungus.
So it's good doing both?
It's good doing both, yes.
Great.
Yeah.
So just to summarize Dr. Tony's protocol there at the Hope for Cancer Clinic in Tijuana, he uses sonophotodynamic therapy, hyperbaric oxygen chambers, far infrared and near infrared saunas, a drastic change to the diet, restricting sugar almost completely. And my favorite, as you saw, was the PEMF, which is pulsed electromagnetic frequencies. If you saw him put that little thing around my neck, he could have turned up the voltage. It probably would have taken me like this, but at the low voltage that they use it at, it actually is a selectively toxic treatment for cancer cells.